Yeah, anger problems can play out actually in a number of different ways. I think when people often think of anger problems, they think of externalized problems. So people acting out in ways that are problematic to other people, saying harsh things or, even throwing things or becoming physically aggressive, right? So that's, I think, the classic anger problem when we think about that, what anger problems are. But that's certainly not the totality of it. So for a lot of times, in people who often aren't presenting for therapy for anger problems, maybe they're presenting for depression or something related to anxiety, they may have problems expressing anger, right? They may have learned that I'm not supposed to feel this way, or I'm not supposed to act in any way that looks angry. And, if we're taught that, if we're taught you can't express this emotion, it's really easy for us to figure out that maybe I shouldn't really even be feeling it. And so you have, I think, some people who, as soon as anger arises in them, they feel a sense of shame, or I'm doing something wrong, or I'm feeling something I shouldn't be feeling. And so they're unable to utilize the energy of anger for things like boundary setting or appropriate assertive behavior. So I think anger problems can go either way, really. I think most often, if you do anger work, most of the folks you see are people with externalized sort of acting out anger, because that's what gets everyone's attention and gets people referred to anger management or whatever. But I do think there are a lot of folks maybe diagnosed with things like depression who struggle with suppressed anger too, and can't access it and feel like it's maybe something bad. So, in terms of conceptualizing anger from a CFT framework, there unfortunately isn't a simple, easy answer, because there are lots of different processes at play. So, people's ability to connect with or to work helpfully with anger has a lot to do with their developmental history and what they learned from their caregivers and what they saw modeled from their caregivers. How anger plays out in us can be shaped by our attachment style and our ability to self-soothe and to feel soothed through connection, and to work with difficult emotions. Our histories that may have shaped us in terms of triggers. The reason I wrote a few books and thought it was important to apply compassion-focused therapy to anger particularly is not that we needed more anger management techniques, right? There actually, for many decades, have been lots of resources that present lots of actually really effective tools for dealing with anger. There are lots of techniques. If you're committed to working with your anger, there are lots of tools you can use. But what I've found over the many years of working with clients who struggle with this is that it's actually very hard for people to access those techniques. A lot of the people who struggle with anger don't access those. In fact, have a real hard time even admitting, I struggle with anger, because I think there's a lot of shame around that, particularly with externalized anger. Admitting you struggle with anger often it means admitting that you've behaved in ways that are really hurtful to people you care about, or that you've behaved in ways that have caused problems in your relationships or in your workplace. And that's difficult to do. So from a CFT perspective, part of what we want to do is help de-shame the experience of anger, so that people who struggle with anger, whether they struggle with externalized anger or suppressed anger because they've learned that there's something bad about it, if they can shift their relationship to anger from this is something that's bad about me that triggers shame that I have to avoid, which is what I think in many cases keeps them from working with it, to recognize that anger is a threat emotion, like anxiety is a threat emotion, or like fear is a threat emotion, and that those of us who struggle with anger are struggling with a threat emotion that we haven't yet figured out how to work with. And so the first part of a CFT approach to anger is help people de-shame the experience of anger, and then begin to unpack and explore how they came to struggle with it, to look at all those different factors that can contribute, and then develop more helpful strategies for relating both to anger and the triggers that cause it, but also to the angry version of the self, to the version of the self that struggles with anger, to de-shame that. So we're helping them develop a compassionate version of the self that can ask questions like, what would that angry version of me need to do better in these triggering situations? So, a moment ago, I alluded to some of the components of CFT treatment for anger. So I'll just elaborate just a bit here. So part of what we want to do initially is to de-shame the experience of anger, to help people relate to it as a threat emotion, to begin to understand how they came to struggle with it. And then we unpack the dynamics, right? One of the things we want to help people do is get to know their anger triggers really, really well. So to notice the progression of experiences that happens when something comes and triggers their anger, and then this cascade of emotions and thoughts and bodily experiences, and give them a way of understanding how that can take on an inertia of its own, and then give them both a collection of tools for working with that. So things like mindfulness, noticing the experiences coming up and the emotions and the bodily sensations and the thoughts and imagery that go with that. And compassionate ways of working with the body, right? Slowing down the body, self-soothing, cultivating compassionate ways of understanding and thinking. And so at that point, we can actually utilize a lot of the pre-existing anger management strategies that we know work and that have data behind them. But the idea of all of that is organized in the framework of what we call the compassionate self. So ultimately, a CFT approach to treating anger isn't about getting rid of the angry self or even really containing it, although shifting the way that we behave is often a big part of it. It's actually about cultivating a helpful version of the self, right? That has a repertoire of skills for working with difficult emotions and expressing them in helpful ways so that the person can engage with the triggering situations in ways that don't continue to trigger further anger, but are actually skillful in terms of working with both the emotion and the situations that provoke them.